Hi everyone, I'm Heather Wen, a retired nurse practitioner and the founder and practitioner at Arizona Healing Alternatives. On this channel, you'll find several videos, what I like to call aha moments, where we'll be discussing issues that impact your health. So whether you decide to use Western medicine, alternative medicine, or even a mix of both, I'm passionate about you knowing what your options are. In this video, we're going to be talking about learning challenges, anything from like dyslexia to ADHD, attention deficit. It used to be called ADD, now it's ADHD, different things like that. I want to give you some ideas on things that you can do to help with those, so stay tuned. So I just want to start this by talking about different styles of learning in general. What I found so interesting was when I was growing up, they didn't test people for whether they were visual learners, auditory, which means listening, or kinesthetic, means doing. And what was fascinating was I always felt a little weird. I had two older sisters, still do, two older sisters, and they were bookworms. They were in there reading all the time and doing all this stuff. And for me, I had a hard time concentrating when I was reading. And nothing seemed to stick. I would read the same sentence like over and over and over again. And what was fascinating was it wasn't until college, when I went off to college, that my roommate was kind of laughing at me because I would take a highlighter and I would highlight like every single sentence. And she said, isn't the point of a highlighter to highlight, the sections that you want to focus on? And I said, I don't know why I'm doing it. I also didn't know why I would go into a classroom, I would have to tape the lecture, come back, and then write every single word. Well, somebody, thank goodness, tested me and said, you do okay with visual, meaning sight, what you see, and auditory, what you hear, but you're strongest in kinesthetic, meaning doing stuff. And that was an eye-opener for me because I always thought I was not very smart. And when I learned that, yes, I may have to do 3 times the work, but when I learned that by writing, I'm physically doing something, it's getting into my brain, then I practically had a photographic memory, and then I was able to use it to my advantage, especially much later on when I went to nursing school and nurse practitioner school. So I see some people in my practice and even some teenagers in my practice that now what's so fun is oftentimes, I know in grade school, sometimes they're doing these tests on students so they can know how they learn best, because most of our schools are visually focused or auditory focused. They're not focused on kinesthetic. And if you're kinesthetic, you have to do something in order to do that. I mean, what do I do for a living? I muscle test people, right? And even then, when it came to a skill, when I was starting an IV or doing things like that, once I did it once, I got it. So, reading in a book just didn't really help for me. So that's in general. It's really important that we look at when somebody is first, has, challenges with learning, what type of learner they are, to learn what works best for them. Number one, because schools can't, they can't teach kinesthetic learners. They can teach visual and auditory, but the other things they really can't. They don't have time for that and trying to do that for every student. So it's learning what is the issue. Then if we start going into other things like dyslexia, where you're putting things kind of in an opposite way, it's very difficult for people with dyslexia. Also attention deficit. So when we go to those sorts of issues and sorts of learning things, there are many, many, many different ways of treating those kind of conditions, many different ways of doing that. And I'm not an expert in all of them. There's things like there's medications sometimes, there's like little fidget spinners, there's all sorts of different things, and there are pluses and minuses to everything. And what I encourage you to do is, if you think, and some of the symptoms can be just you have a child or even an adult where all of a sudden they just can't really focus on something, or they can focus intensely on one thing, but then other things they can't, or they seem almost forgetful, or they just can't sit still. And you'll notice even in my videos, I tend to rock back and forth, just simply because my body, as kinesthetic as I am, I tend to have to move. And so is it just that, or is it something else? Which is why it's so important that people get tested and figure out, is it really an attention deficit thing, or is it something different? Because for me, fortunately, I can focus, I can do things like that. It's just my body really just needs to keep moving. Probably because we have poor circulation in my family and I need to get the blood back to my head. I'm not quite sure, because that is a possibility in my family and the way things run. But other than that, what I do in my practice is it's so very neat. There's some different options, and I have different corrections that I teach my patients for the things like dyslexia, for things like, oh my gosh, I can't remember things, or memory issues. But also, one of my favorite ones is Viktor Frankl put this all together for different types of visual retention, auditory retention. Also a physician that Dr. Frank mentions, Dr. Levinson at New York Medical School, who discovered that oftentimes there can be like an allergic, similar to allergies, where you get the runny nose and stuff. There can be gunk in the eustachian tube. The eustachian tube is a tube that connects the ear into the throat. Well, you can clean someone's ears. You can try to do sinus corrections for allergies, but how do you clean out this gunky stuff that's sitting in the eustachian tube? And so what they did was, Viktor Frankl and his colleagues, they made this correction for it and then added in a specific supplement. In fact, Dr. Levinson, when he did this, found that kids jumped 2 or 3 grade levels once they did this treatment. And so it's fabulous. I work with this all the time and work with people on that, because he said even an antihistamine sometimes can't clear out the gunk in that eustachian tube. So that can sometimes be an issue. Also in what I do, there's allergy harmonization. Sometimes people are allergic to their own neurotransmitters, which are how the neurons connect up in the brain. And when that happens, it's difficult for kids to focus or things to do that. And there are some corrections where it's treated as an allergy in this medicine. And so it's so much fun for me to see that and see changes that can happen with that. And sometimes I use it for children with autism as well. And sometimes that can be helpful. Sometimes it's little improvements, and sometimes it can be dramatic improvements. It just depends on the person. But whatever way you decide, it's looking at and finding out what really the problem is, going and getting help and finding out what the problem is, figuring out, is it really a learning issue? Is it another issue, a chemical issue? What is it? And then once you find that out, it's looking through the options. And even if it's medication, I have people who are on medication in my practice, and I just make sure that the body's in harmony with it and using what it needs to. It's treated like an allergy. And what I do too, we clear that if there's any problem with it. And then people, because their medications give me very helpful. There can also be cognitive behavioral therapy. There can be psychologists, things to teach that child or that adult how to learn or how to work with it. So I encourage you to research all sorts of different methods. If you know somebody, or it's a child or anybody who is struggling with any kind of learning challenges, I would say to research it, find out what the options are, know what your options are, and then pick what's right for you. If you've liked what you've seen, please feel free to hit that subscribe button. Also, you can hit the notification bell, and anytime videos will come out, you'll be notified. Also, feel free to leave comments in the comment section. I'll be happy to answer them. So, figure out what type of learner you are, figure out what works for you, and figure out what your options are so that you can get the best and the most every single day. Have a good one.